Why are fibromyalgia patients sensitive to sound and light? Imagine feeling overwhelmed by everyday sights and sounds that others barely notice. That's often what people with fibromyalgia experience. Their sensitivity to sound and light is a common symptom that can make daily life challenging. But what causes this heightened sensitivity? It all comes down to how their nervous system processes sensory information. In fibromyalgia, the nervous system becomes more responsive than it should be, a condition called central sensitization. This means that signals from the brain and spinal cord amplify sensations, not just pain but also sounds and lights. So, sounds that are normal for most people can feel loud or jarring to someone with fibromyalgia. Bright lights might seem harsh or even painful, and this isn't because the eyes or ears are damaged. Instead, it's how the brain interprets these signals that changes. Research shows that in fibromyalgia, areas of the brain responsible for processing sensory input, like the insula, become more active or respond abnormally. This leads to an exaggerated perception of sensory stimuli. Some studies suggest that initial sensory signals from the lower parts of the brain may be delayed or reduced, but then the higher brain regions respond with an overreaction. This imbalance causes the brain to perceive normal sounds and lights as overwhelming or distressing. This increased sensitivity can cause fatigue, headaches, and a desire to avoid busy or noisy environments. It's not just about discomfort. It can also contribute to the overall burden of fibromyalgia symptoms. It's important to understand that this isn't a sign of damage to the sensory organs themselves, but rather a change in how the brain processes sensory information. Because of this, many people with fibromyalgia find relief in quieter, dimmer environments. Managing sensory sensitivities often involves creating a calm space and pacing activities to avoid overload. If you or someone you know experiences these symptoms, consulting a healthcare professional is essential. They can help develop strategies to cope with sensory sensitivities and improve quality of life. Remember, everyone's experience with fibromyalgia is unique, and personalized medical advice is always the best course.